we are here in a press conference that is chiefly led by CARPHA, the Caribbean Public Health Agency. CARPHA became involved when the health concerns at the Basseterre High School have been referred to the highest levels of the government, and then to CARIRI, a reputable organization based in Trinidad, the Caribbean Industrial Research Institute. And CARIRI came to St. Kitts and Nevis first in November of 2012 to investigate the environmental health issues at the Basseterre High School. Subsequent to the visit, a report was submitted which outlined a number of recommendations to improve the environmental health and safety standards at the institution, dealing in the main with the labs at the school and other things related thereto. CARIRI again returned in May of 2014, mainly as an exercise to further engage other stakeholders prior to coming back as we had planned to do further investigation. It so happened that on their second visit, which was just prior to their third visit, the school was closed because teachers felt that the environment was not safe. And we supported that position. We adopted a makeshift system at the Washington Artful High School, and school continued there until the end of the school term. I want to say thanks to the management and staff of the Washington Artful High School at this point in time, who were very willing to work with the ministry, or in fact the ministries of education and of health and the Basseterre High School. I know that we've had some challenges in that arrangement. Nonetheless, it was the best arrangement at the time. And so we are very happy for the support that has been given by the management of that school. Today we are here because after CARIRI submitted their report on the 10th of June, we were asked as government agencies, the Ministry of Health, the Ministry of Education and Public Works, to work collaboratively with all stakeholders to implement the recommendations which had been made by CARIRI, by CARPHA itself, because CARPHA made some new recommendations subsequent to its visit in May of this year, and to also consider the implementation of the recommendations which have been made by the Bounce and Williams Committee, as well as Dr. Milton Whitaker. Dr. Whitaker was the first investigator of the Basseterre High School situation early in 2012. So the purpose for CARPHA's being here this time around is really to look at the recommendations which ought to have been implemented, and those range from physical works that needed to be done to putting in place plans such as maintenance plan, hygiene plan, air quality, indoor air quality management plan, and things like that, and also a communication strategy. All those were recommendations that were made, and we've made every effort to implement all of these recommendations. For example, in relation to the improvement of communication, which was identified by both CARIRI and CARPHA as a significant challenge, they felt that the fact that there wasn't optimal communication among the stakeholders, that could have been preventing understanding and implementation of the recommendations and the achievement of satisfaction by all concerned. So we set about almost immediately to ensure that we had regular meetings. We have been meeting every Friday. And involved in those meetings have been the various ministries of government that I've mentioned before. We've had the PTA and Mr. Walwyn, and sometimes other persons accompanying him. We have had the SKTU, the Teachers Union, led by Mr. Ron Dublin Collins, now Bishop Collins, and other members of his team. The Basseterre High School management, headed by the principal, Mrs. Carleen Henry Morton, other members of her team. And we've had the involvement of the Labour Department through the direct participation of the Labour Commissioner, Mr. Spencer Amory. So I think we are very pleased to have achieved that. The meetings have been productive, they have been amicable, they have been meetings in which we have demonstrated understanding of the need to improve the standards at the school, and also to ensure that the children, when school starts, are in the best environment for learning and for the protection of their health and safety. Those have been concerns at the top of our minds as we sought to discuss the issues and implement the recommendations, and importantly, oversee together the implementation of those recommendations. In between our weekly meetings, which happened on Fridays, we have had a number of tours together at the Basseterre High School. We have had about 3 or 4 of them. We visited together with all the stakeholders just mentioned, and we have sought to not only see whether the recommendations were being implemented and were in fact implemented where that was the case, but we also tried to identify other issues whose resolution would assist in improving the standards at the school, and we have identified a number of those. For example, we have said that, well, in fact, one of the things that we had identified at that time was that we needed to put carpet in the auditorium of the school. That was identified as something that could assist. I am being told that that may not be advisable, given the environment in which we're operating, and a few other things which we are committed to doing. Although they were not part of the original set of recommendations, we have viewed them as things which are important to be done. Nonetheless, we have said that these are to be considered as work in progress. That is, we believe that upon satisfactory completion or implementation of the recommendations which we have been given, and with the verification of the CARPHA team, which we have asked to come to supervise and oversee what we're doing, we believe that if there is satisfactory performance with regard to the implementation of those recommendations from the standpoint of CARPHA, then we should have no difficulty in moving forward. We recognize that Basseterre High School, as any other high school, is not a perfect environment. We're trying to create an environment that is reasonable, an environment that is safe for all concerned, students, teachers, and persons who may from time to time find themselves at the school. And so I believe that we have been very pleased to have had the partnership with all the stakeholders, including CARPHA, who's present today, or with the representation of Dr. Babatunde Elokore, who's at the head table. And I must also acknowledge Mr. Lesman Magloire, an environmental health specialist with CARPHA. So with those few words, I would now want to yield for the persons to make their contributions, and hopefully their contribution.
So, sort of summarize with a little bit of what remains to be done. So CARPHA is the Caribbean Public Health Agency, and we are based in Trinidad and Tobago, working out of Port of Spain, and we are the main public health agency within the region, and we are a CARICOM institute. We were asked to review the situation at Basseterre High School in St. Kitts and Nevis, and at the request of the Ministry of Health, and this we have done and provided a report with recommendations that were accepted by government. The recommendations that we gave were based on our findings, a review of the available evidence within the particular area, as well as a review of previous reports from Kariri, as well as from Mr. Williams and Dr. Whitaker. So the recommendations that we reviewed yesterday are based entirely on the ones within our report, and that is what I will report back to you. Overall, we found the remediation measures and the implementation of those measures to be satisfactory. This was based on a two-level assessment for each recommendation, and that is whether each recommendation was deemed to be satisfactory or there was no compliance. Major improvements have been made to the laboratories, such as the installation of extractor fans, replacement of louver windows, and the installation of fume cupboard and hoods, as well as the appropriate use of shelving to store chemical materials. All wet and damp materials and items such as books have been disposed of, and this then means that we have a reduced possibility of having mold growing on those materials and providing potential for irritation of skin or respiratory tract. Pest control measures have been put in place, and this is to ensure that the environment has a minimum number of vermin such as rats as well as cockroaches and other pests that may be in the environment. The water quality available within the school environment was also checked, and this was found to be adequate in terms of the amount of bacteria potentially within the system. The entire septic system within the school on both campuses has been tested using what is called technically a blue flush test. And this test uses basically a blue dye which is flushed through the system, and if there are any leakages within the system, then that blue dye usually will be identified on the surface. This test has been carried out twice, and no leakages have been reported following those tests. There was mold identified in the theatre arts office, and this has been removed, and the wall in question has been remediated appropriately. The flat roof above that office has also been repaired and would now appear to be sufficiently robust for purposes, and we will be asking the school authorities and the government to maintain an eye on that to ensure that there is no further seepage of water into the rooms below. The general cleaning and tidying up of the environment continues, and there are some areas that are still to be painted, and some other areas where there is to be removal of shrubbery from around the school, around the classrooms or the laboratories to reduce the potential for pests and other vectors to hide within those areas. Soil samples were taken in 9 areas, and we had 1 which had a high coliform count. We have recommended that there should be a repeat of samples in that particular area, and so 3 samples will be taken today, and we will take them with us for testing in our laboratory in St. Lucia. We have also advised that the chlorine levels in the piped water to the school be increased, because upon testing yesterday we found the chlorine levels to be present but to be low, and so therefore there is a need to increase those from source to ensure sufficient and adequate protection. We also detected a sulfide or sulfurous-like smell when taps were run in the laboratories and in the female toilets. This is believed to be due to accumulated waste within the U-bends of the sinks. And again, what we have recommended here is that those U-bends be replaced to negate that particular issue. This is based on finding other areas where U-bends had been replaced, there was no sulfur-like smell, and also when we flushed various toilets, again, there was no smell emanating from the toilets. We await the final draft of the maintenance plan from the ministry. However, we have received the communications strategy, and again we would like to commend Minister of Health, Minister of Education, as well as the various stakeholders, the principal and the Teachers Association and the Parent Teachers Association as well, for pulling together in order to move forward with this particular issue. We had also recommended that a school nurse be employed within the school full-time. We are informed that for practical reasons this is not possible, but that a nurse could be supplied for 3 days a week to the school. We find this acceptable, providing that those 3 days are clearly identified. Everybody is informed which 3 days the nurse will be in the school, as well as the times, and that these are adhered to consistently for the period of time that the nurse will be there. The school has identified a place where the school nurse can be based within the campus, and unfortunately we were not able to see this, but we have asked for pictures to be sent to us so that we can have a look at the space that has been allocated. So overall, I would like to say, based on the recommendations that we have made, we find the current remediation being conducted in the school to be satisfactory, and we would like to commend all involved for playing their role in an effort to respond to this particular situation. From our experience, my personal experience, as well as that of my colleague, Mr. McLaugh, and the scientific evidence, what we know is that remediation activities, once they are carried out in situations like this, there tends to then be a significant decrease in the health complaints of the staff as well as the students. And so we are looking towards that being the case here in Basseterre High School, and we will continue to support the Ministry of Education and Ministry of Health in their efforts to ensure that there is an environment which is both safe and provides a conducive environment for education and learning. Kariri are currently also on site carrying out their tests to look at the quality of the air in various parts of the school. I cannot speak to those, but that is just to inform you that we are all working together in this to ensure that we have a safe environment conducive to all. Thank you very much.